My lady, the emergence of COVID-19 in December 2019 presented this country with an unprecedented procurement challenge. Some figures illustrate the scale of this challenge. Early indications are that the Department for Health and Social Care spent in the region of £15 billion on PPE procurement through the lifetime of the pandemic, during which over 30 billion items of PPE were purchased and over 25 billion items of PPE distributed to people dealing with it. DHSC and the Cabinet Office spent more than £500 million in the early part of the pandemic to reach a target of procuring 30,000 ventilators by August 2020. By late May 2021, over 690 million lateral flow tests had been dispatched within England as part of the NHS Test and Trace programme. As my lady will know, the National Audit Office, Audit Wales, and Northern Ireland Audit Office and Audit Scotland have carried out a significant amount of work in this area. In carrying out our investigations, we are, of course, bound by the restrictions imposed by parliamentary privilege, but as part of our investigation, we will be acquiring similar relevant facts and figures of our own. There were also significant issues which arose, the scale of which the inquiry is engaged in investigating. Early indications suggest that a number of PPE contracts awarded were later disputed. The inquiry is also investigating concerns that some contracts awarded may have been fraudulent, that prices were inflated, or that PPE was defective or unusable. The procurement challenges were not limited to government departments. NHS trusts, hospitals, local authorities and care providers all faced difficulties too. A key focus of this module will be the way in which this challenge was met. Questions arise about how government procurement in the pandemic operated, including the effectiveness of spending controls, the prevalence of fraud, and the steps taken to prevent it, any conflicts of interest or maladministration, and whether procurement processes were able to strike an appropriate balance between speed and safety on the one hand, and value for public money on the other, whilst ensuring that the process was fair and transparent.